There are a lot of patterns in plastic surgery, and an emerging pattern that I'm experiencing and observing is a relationship between inquiries for jaw augmentation and people who have had a history of orthognathic surgery, also known as Bimax surgery. And a lot of people who come in to enhance their jaw angles just so happen to have had orthognathic surgery on their past surgical history list. And to some people this may sound sort of intuitive. People are, focused on their looks and things like that. But orthognathic surgery is not all too common. And although it's a pretty commonplace operation nowadays, there seems to be a high prevalence of people who are interested in specifically customized jaw angle implants for those who have had previous orthognathic surgery. Now, to understand why, you've got to understand what orthognathic surgery does. This is a mandible. And a mandible is essentially a three-dimensional ring. It looks like it's a U shape, but it's essentially a ring. You can't fracture it in one place without another fracture somewhere else happening, for example. And so when you augment this three-dimensional structure or change it, you can only really change it in 2 dimensions. And so if you're going to undergo bilateral sagittal split osteotomy, for example, what happens is your surgeon is going to make a cut through your bone like this. And once that bone has been cut on both sides, specifically on both sides, then you can advance the teeth outward and the chin outward, because you are dissociating what we call the vertical ramus of the mandible and the condyle, which kind of holds it into the joint, from the teeth. And you can just separate, disarticulate. You can move the teeth out and project the chin and the lower face more. All these things can be done while preserving the nerve, which should be the case. Sometimes these nerves do get affected, but that's not going to be part and parcel to this video today. So once we've reshaped the bone, why is it that there seems to be this preponderance of people who want to further enhance the jaw? Well, I think it has to do with the fact that we're trying to reshape a three-dimensional structure in 2 dimensions. For example, if you're going to do the bilateral sagittal split osteotomy as shown here, and you're going to advance the teeth forward, you can't do that and widen the jaw at the same time. And so what you're doing is simply elongating it. Meanwhile, you have the gonial angle, which is this landmark, which is not really changing its position. It's in a fixed point. And the only thing that's changing is the alveolus, which includes the teeth, and the menton or chin. When you bring this forward, everything else stays put. You screw it together, you fix it, your profile looks a lot better, but there still is something left to be desired. Anything from subjective findings like feeling a palpable step off where the sagittal split osteotomy occurred, to seeing that the jaw angle is either too obtuse of an angle, or it's set too high, or it's not wide enough. These are the biggest reasons, in my experience, that people desire custom implants to enhance it. For the most basic of cases, you can also enhance this with off-the-shelf silicone implants, but once you start to get irregularities at the osteotomy site, it makes sense to get something a little bit more specific. And so custom jaw angle implants really fit the bill for this. I want to show you a more advanced case, and here is a model of a patient who has had previous bilateral sagittal split osteotomy and mid-facial surgery. And the objective here was to take a very small mandible and bring it forward for airway improvement. But what happened is you can see a lot of the vestiges of having had a very small mandible. For example, nothing back behind the osteotomy site has changed. You still have a very weak and narrow mandible. Not only that, but it's still a little bit off to a cant. So the occlusal plane is improved, but now the chin, for example, is not straight. So in this case, where you have significant residual asymmetry of the jaw angle, what we can do is manufacture implants based on your unique CT scan and create a lot of contour improvement, in this case not only for the jaw angles, but also for the chin. For example, if you look straight ahead, you'll see that the chin continues to have a cant. But with a customized jaw implant, we can fix that cant. This is something that I think the orthognathic surgeons may have a hard time augmenting with such precision. Furthermore, for the jaw angle, we can take a jaw angle implant and do our best to conservatively correct for some of the persisting height and width issues that remain. For example, we could place a very customized implant to give more gonial height and a stronger gonial angle, but also from a front view, a better projection laterally. This will help bring that two-dimensional augmentation that a previous surgery achieved successfully to 3 dimensions. And not only that, but in this case, we can also correct the asymmetry on the other side with a more conservative augmentation of the larger but still inadequate gonial angle on this side. And again, these should key into place better than any silicone implant can. I'm a huge fan of using PEEK implants because they don't fragment, they look and feel like bone, and yes, in my experience, these can be removed with less difficulty at a later date. I hope this helps clarify some of the confusion that may exist between patients who have had orthognathic surgery and yet still desire something, and patients who are wondering why so many people are interested in custom jaw angle implants. Thank you so much for watching this video, and I hope this helps.